Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery Wisdom Teeth and Denture Implant Center, and my mission is to make sure that you guys are the most educated dental patients out there. All right, so I wanted to share this video with you, this case with you before I take off at the end of the day. So this is a patient that came into my office this morning for a consultation, 42-year-old female who recently had her wisdom teeth taken out about 10 days ago at another oral surgeon's practice. So to just kind of let you know the background of her case, what happened was that she was advised by her general dentist to get her wisdom teeth out. They really hadn't given her any issues to that point, but the general dentist told her, hey, like this can turn into a bigger problem in the future one day, so like you should still get these wisdom teeth taken out now versus like later on when they become a real problem. So she agreed and she decided to go ahead and do it. So she went to an oral surgeon and had her wisdom teeth out. So she had them extracted about 10 days ago, that she said. And here we are, or maybe it was like 2 weeks ago, but she was telling me that even up to the 10-day mark, she was having like insane pain and she still can't go to sleep. So let's share with you guys basically what I see. So before I even walked into the room, what ended up happening is that she had a coronectomy. So basically, we would do coronectomies if we find out that your wisdom teeth are too close to the nerve, your inferior alveolar nerve here. And so this like white, this is actually the remnants of the root tips of her two lower wisdom teeth that she had extracted. This shadow is her nerve. And so next logical thing I wanted to do was I said, okay, let's take a look and see her nerve, where it really is. And I could see that her nerve is right here, and this is her root tip. So I was like, okay, like I see, as I scan across, I could see the roots in proximity to the nerve. And here I am, I'm thinking, all right, so I do a lot of wisdom teeth and I see a lot of complicated cases, and like that's not like too close. I mean, it's close to the nerve, but not a case where I would really feel that I would tell the patient that she has a really potential serious risk of paresthesia and or what we call nerve damage. Um, so basically, a coronectomy, I completely don't agree in this case that it was the right treatment plan. So bottom line, what I think could have done, they could have done on this case is that, they could have looked at the CBCT, that 3D scan, and properly been able to treatment plan her case. Well, then I asked her, I was like, well, I looked at your 3D scan, and so although your root tips are kind of close to your nerve, and like, there always is a chance of like potential paresthesia, meaning numbness of your lip or chin after that procedure, most commonly would be just a temporary thing. We're always supposed to tell you that it could be a numbness that could last your whole life. Again, it's insanely rare. And when I look at that 3D scan, I would say, I really would say there's no chance that the patient would get numb from that case. Um, but I was like, that's what that 3D scan tells me. I was like, did they show you the 3D scan? And she said, no, they never even took a 3D scan. So I was like, okay, that's interesting. How did they not even take a 3D scan and that patient had, like was told to get a coronectomy? So, especially nowadays, it's 2021. It's now become more standard of the care. So you see more 3D scanners in oral surgeons' offices. So that kind of took me by surprise too. So long story short, she was like, okay, so I'm here. I'm in tons of pain every day. I don't want to go back to that, that other surgeon's practice. What do you advise that I do? I said, okay, so based off what I see, at this time, I don't see infection. And how would I know if I see infection or not? I'm going to look for what we call purulent exudate. Do I see like pus coming from the area? Do I notice some sort of swelling occurring also? Do I see any changes on the x-rays? And at this point, I didn't see anything. So the antibiotic that she was on, I maintained her on that. But if I did see any potential infection, I would have actually changed her antibiotics. Also, the symptoms that she was describing were the symptoms of dry socket, which were intense ear pain, severe pain, not able to sleep at night. And so, based on what she was describing, she had some complaints about the communication that was happening with this other surgeon's office. So she was just getting a little frustrated at that point. So I said, here's the thing, dry socket, usually you give it a few days and it goes away. So, they were a practice that doesn't prescribe narcotics like hydrocodone or oxycodone. So she didn't have access to stronger pain medications other than Toradol, which is, an anti-inflammatory, and NSAID, a great one, but definitely probably need, like in her case, she needed a stronger pain medication. So I told her, hey, let's try to ride this out for a few days. If things are really not getting better and you really feel that you need to get those root tips taken out, well, here's the problem. No surgeon's going to want to take a look at this case where now you put kind of like tied their hands behind their back, where we see a case like this where your root tips are now close to the nerve. You extracted the other part of the tooth that now makes it more difficult for me to extract the remaining part of the tooth. Without going into too much detail, he just kind of makes it like definitely more complicated for anyone to go in and safely remove all the root tips. So something I discussed with her is that she reasonably might need to consider as an option is you might actually lose your second molars because they're close. How close those root tips are to the second molar, it's going to be easier if we just extract your second molars with your wisdom teeth. So that's a potential option, and who wants to hear that? So unfortunately she's going to have to make a decision based off of where she is with her symptoms, and so we're just going to kind of see how that goes. So what can we learn from the story? Bottom line, if we're ever talking about doing something like a coronectomy where we're leaving some of the root tips in, we have to have a 3D scan, and we can't be making any judgments about potential paresthesia or nerve damage based only off of a 2D scan. We need to have that CBCT, that 3D scan, which is really important, so that we can not only see the true danger of potentially getting paresthesia or any other types of complications, but also our ability to surgically plan that procedure, especially in the year 2021. Things really changed in the last few years with the technology that we now have access to that's more commonplace in these surgery practices. So hopefully you guys found this information to be helpful, and if you did, please give me a thumbs up. I appreciate it. Thank you.